Symptoms, diagnosis, and conditions. Introduction. ICD coding is the backbone of diagnosis documentation, translating clinical conditions into standardized codes. This module focuses on how to accurately code symptoms, provisional diagnosis, and confirmed conditions, ensuring precise clinical representation vital for reimbursement, statistical analysis, and quality reporting. Understanding symptoms versus diagnosis. Symptoms, these are patient reported or observed signs such as pain or fatigue that indicate a potential underlying condition. Diagnosis, these are clinically confirmed health conditions like pneumonia or hypertension that explain symptoms. Coding approach, always code the most specific diagnosis supported by documentation. However, symptoms may be ICD codes when a definitive diagnosis is not established. Next, coding symptoms. When to code symptoms? When no definitive diagnosis is available for initial presentation or complex cases. Examples of symptom codes include R505 for cough and R10.9 for abdominal pain unspecified. Implications. Using symptom codes appropriately allows for billing when diagnosis is uncertain but services are rendered. Next, coding diagnosis. Diagnosis coding. Assign codes based on clinicians' documented or confirmed diagnosis. Specificity is the key. Use the most detailed code available, considering laterality, severity, and manifestation. Examples: J18.9 for pneumonia unspecified organism, and I10 for essential primary hypertension. Next, use of validated codes. Always verify that the code chosen is valid and supported by documentation. Next, comorbidity coding conditions with multiple manifestations and comorbidities. Multiple diagnosis. Code all relevant conditions that impact treatment or patient management. Primary versus secondary conditions. Sequence the primary condition first, followed by secondary conditions. Use of combination codes. Use ICD codes that capture multiple conditions when available to improve accuracy. Next, special coding considerations. Uncertain diagnosis. When the diagnosis is provisional or pending, code the conditions as documented, often using suspected or possible codes. Chronic versus acute conditions. Differentiate between ongoing, also referred to as chronic, and new, also referred to as acute diagnosis, coding accordingly. Condition resolution. For resolved conditions, Avoid coding unless relevant to the current treatment or evidence. Next, best practices in coding symptoms and diagnosis. Thorough documentation review. Ensure providers' documentation clearly supports the codes assigned. Be specific. Use the most precise codes possible to reflect the patient's condition. Avoid upcoding or unbundling. Code accurately without inflating severity or duplicating codes. Stay updated. Use current valid codes following annual updates and coding guidelines. In summary, accurately coding symptoms, diagnosis, and conditions in ICD is essential for representing the patient's clinical picture. Proper coding impacts reimbursement, clinical data quality, and healthcare analytics. Always base your coding decisions on complete, accurate documentation and follow official guidelines for specificity and compliance. Thank you.